My name is Marc Dones. I use they, them, theirs pronouns, and I am the I'm hanging on to new as long as I can, CEO of the King County Regional Homelessness Authority. I do not have a PowerPoint. I am often quite informal, and so I will just share with you what my thoughts have been since stepping into the role, and look forward to any questions. As some folks know, I also was fortunate enough to lead the participatory audit and design process that gave rise to the authority. Did not think I was going to be in this job at the time, and then the world changed. I think that what's important to do some context setting around, just in terms of like where we're at, is that the legislation that creates the authority was signed on in December of 2019. Someone was supposed to be in my job in February, March of 2020. And instead we had a global pandemic that is still happening. And so as a result, I didn't even decide that I was going to apply until a full year after the fact. So December 2020, was appointed in March, began my job in April. And so by the most generous of assessments, we are a year and a half behind. And I just think that's important. I think it's important to do that context setting about where we are in relationship to where we thought we might be. That said, our focus over the last several months has been, or my focus initially for the first couple of weeks, because I was an employee of one, was on ramping up a team so that we could undertake the essential administrative functions that we need to begin doing essentially immediately. So our first major body of administrative work was ramping up capacity internally, both from a systems perspective and a staffing perspective, so that we could take on the contracts and funding that currently sit at the city of Seattle and with the county, and administer them beginning January 1st of 2022. That is roughly $140 million annualized in funding, the vast majority of which, about $135 million, walks out the door in grants and program supports to providers across the county who serve folks experiencing homelessness. That will happen by January 1. There is no path to it not happening. And so that is the big thing that we're currently focused on. Additionally, we are trying to identify ways outside of that administrative work to act with urgency. And one of the things that I heard Councilmember Mosqueda say that is so important to the work that we undertake in the housing and homelessness space is clarity around urgency, right? And that we do need to be acting quickly and trying to move through and past bureaucracy as much as possible. And so to that end, my team has also identified 3 areas that we are looking to focus on outside of budget. We're actively working on public-private partnership, looking at potential ARPA investments or other ways that we might bring funding to bear more quickly. The first of those is on standing up a peer navigation workforce. One of the things that we hear a lot from folks experiencing homelessness is that the system is extremely fragmented, and their ability to navigate it successfully is often made simply by having a relationship with someone who has a lot of insider knowledge and is able to walk with them from sort of beginning to end, right? What we want to make sure is that is a function of the system rather than a bug. And so really take the opportunity to lean into that by expanding peer support options across all of our work. My vision for that is that essentially I could say to a peer navigator, you are assigned to this encampment, and everyone in this encampment is your person until they are housed, right? So that it is truly end to end in terms of providing that support. The data from other systems supports peer navigation. It is a standard at this point in behavioral health, in substance use disorder, and recovery spaces, and has a significant peer-reviewed literature behind it. In addition to also being Medicaid reimbursable in some instances, and so we also see that as a way to really approach this at scale. The next thing that we're really focused on is data. We think it is important that we actually have, a solid grasp on who needs our help and where they are, so that we can deploy resources in alignment with that. I want to be really clear, because often I think our data teams get maybe unfairly maligned. The issue is not that we don't run, particularly our HMIS database well. The issue is what HMIS is. It just isn't actually designed to answer the questions that we have. And so as a result, our team is really looking at how to take a step back, identify what those questions are, and then develop and deploy the data infrastructure, both from a collection standpoint, but then also from an actual database standpoint, in order to have the information at hand necessary so that we can answer the questions like, how many people are experiencing homelessness in East King County? Again, where are they? What are the needs? And what is our plan for that? On our final issue area or focal point, which is very in line with the work that Leo and Marc are doing over at the county, is a focus on housing. Housing is the solution to homelessness, and we are really keen on ensuring that our system has a housing orientation, both in its crisis response and also in pathways to permanency. And so with that in mind, we're looking at taking the really excellent work that has been done during COVID and through COVID de-intensification, at standing up various emergency housing and de-intensified shelters and non-congregate shelters, and looking to push that farther into something that we're calling bridge housing. Essentially, what we're looking to create capacity in the system for is something that is post-shelter, but pre-whatever your permanent solution may be, right? So if you're headed to PSH, or you're headed to deeply affordable housing, or back to market rate housing, but you need something in between, that something in between shouldn't be shelter, actually. Shelters were not designed for that. They are traumatizing, particularly to families and young children. And we have an opportunity, I think, in this moment to do better. With that in mind, I think it's also important to note that the way our system is currently structured, we have very little in that in-between space. We essentially have shelter and we have permanency options, and then we don't have anything in between. And so as a result, at the administrative level, what we have said to people is essentially, while you wait for whatever your permanent option is, you can wait outside. And so part of addressing unsheltered homelessness is ensuring that our system has flow-through capacity, and that flow-through capacity, again, is focused on housing style options that provide people with stability, so that they can re-engage with community, natural supports, and also other employment supports if needed. The only other thing that I would say, and I'm trying to be cognizant of time so that there is time for questions, is that, in reflecting on sort of my first 6 months, I think we just need to be really clear-eyed about the magnitude of the problem, right? Like, we are in a crisis where the best data we have access to right now suggests that the number of people in a given year who need support from the homelessness response system is about 20,000. And our shelter bed availability is below 6. And so with that in mind, right, I think that we just have to be really, really, really clear that in order to bring the system to capacity regionally is going to require some really significant reconfiguring of where and how our investments are sited and placed, and to really think through how we are ensuring, right, that folks have the right supports at the right time, that we're avoiding shelter, frankly, avoiding bridge housing where we can through, the smart use of diversion, but also thinking about ensuring that those crisis response frameworks in the shelter space, in the bridge housing space, are at scale to support the number of people who need us.